Welcome everyone around the world to It's a Wrap with Rap. I'm your host, Ron Rappaport. I would like to thank all of our listeners, viewers, supporters, and sponsors for making this podcast such a success. The podcast is being heard and viewed in all 50 states, all provinces of Canada, and over 70 countries around the world. The podcast has been ranked by FeedSpot as one of the top 35 overcoming adversity podcasts on the web. Please visit the podcast website, itsawrapwithrap.com, for all the episodes and to order logo merchandise and other fine products from our sponsors. This podcast features people who have overcome life's challenges and adversities, people who can inspire, motivate, and educate us on an assortment of topics. My guest today is Dr. Charlie Ferrer. Dr. Charlie Ferrer is a world-renowned clinical sexologist and sex therapist. She is the award-winning author of several books on relationships, sexuality, self-empowerment, and breast cancer. She was diagnosed with breast cancer in 2016 and thyroid cancer in 2017. Frustrated with the lack of information and treatment options provided to cancer patients, Dr. Charlie created the Cancer Tamer Foundation, which focuses on education and empowerment. In 2019, she wrote the play Breast Cancer Diaries, which premiered to a sold-out crowd on Staten Island and Manhattan, along with 2 documentary films, Messages of Hope and Faces of Breast Cancer. Her philosophy on breast cancer is realizing that cancer is not an outside force invading, but an inside force residing. It's in our blood, our breasts, our DNA. In our attempts to destroy it, we are inadvertently destroying ourselves. Dr. Charlie's revolutionary new way of thinking about cancer is turning heads, creating controversy, and reminding women and men that we should not be at war with our body. Welcome, Dr. Charlie, to the podcast.
Hey, Ron. Thank you so much for having me here.
Well,
I
thank
really
you.
appreciate it. And hi to everybody who's listening in.
Well, it's a pleasure to have you. And I might add that when I was first diagnosed back in 2019 with my first breast cancer episode, male breast cancer episode, I traveled to Orlando to a male breast cancer happens.org convention, and Dr. Charlie wangled me into a room, and before I knew it, I was in one of her documentaries. So
And you're in the documentary, yes.
yeah. So we have met before in Orlando. Now, before we get into the questions for you regarding the Cancer Tamer Foundation, I want to ask you about your frustration on the lack of information and treatment options you encountered regarding cancer.
Yeah. So when I was first diagnosed, I was diagnosed in 2016. And I'm one of these people that I believe in getting all the information. Give me as much information as you can so that I can make a good decision. And what I found was that the doctors were saying, well, we'll tell you what you need to know when we feel you need to know it. And my take on that is like, okay, so you're going to let me get hit by the bus before you teach me how to cross the street?
Right.
It just doesn't work that way. And so I started going out and getting information and just I would call the American Cancer Society at 3 and 4 in the morning, trying to get them to answer questions and send me more pamphlets. And so, and I just devoured anything and everything I could read, but being very conscientious of when I started looking for information, there's so much misinformation on the web. When I started looking for my information, they told me I was going to die in 2 years if I didn't get these vitamins that they had for sale, so be very conscientious of there's so many hoaxes out there and they prey on your fear. And so that was one of the reasons why I started the foundation, because of the fact that there wasn't information being provided. For me as a patient, nobody would tell me what was going on. They kind of did well, why aren't you just shutting up and doing what we tell you? And I'm like, well, because I'm the type of person that you need to tell me what my options are so then I can decide. Don't just
Right.
walk into a room, say, okay, well, you're gonna have a dual mastectomy and we're gonna remove your ovaries. And I'm like, wait a minute, that's not what we're doing. You must have the wrong chart because that's not what we're doing. And the woman that's sitting there, she goes, oh, your name's Charlie Ferrer, right? And I was like, yes, that's me. And she goes, well, that's what you're here for. And I'm like, no, that's not what I'm here for. And she asked, well, why do you think you're here? And I said, well, I was just told that I had breast cancer. So I need to know what we're gonna do, how we're gonna, how we're gonna move forward. And she's like, oh, well, I'll come back then. And I'm like, who the hell are you? She goes, oh, I'm the breast surgeon. Like, you don't even
Wow.
introduce yourself. So it became that part of me getting very frustrated because they didn't want to give the information, they didn't have the time. Go and make another appointment with us and then we'll talk to you. And I'm like, I'm right here. I've waited an hour in your waiting room. I don't want to spend my time when you're not going to tell me. And so I started getting more information, and that's how Cancer Tamer came about, because everybody talks about how, you have to be at war, you have to fight, you have to survive, you have to, you can battle it, you're a survivor, you're a warrior, you're this, you're that. And it's like, wait a minute, why should I be at war with my body? That's not what I want. And so my thought on it was, I don't want to be known as a survivor. I don't want to have to battle. What else can I do? And it was like, well, I can learn how to tame the cancer. I can learn how to get the cancer to quiet down so that I can actually live with it better if that's what's going to happen. And the way I look at it is whether or not you go out and you become cancer free, or um you have the surgery and they take out the tumors, you're still going to have that mentality, that fear, that connection to the cancer, whether you're cancer free or not. And so I always say, well, you need to tame that piece too, because if you're going into your follow-up appointments terrified that there's something wrong with you, that you, oh my gosh, well, I don't know if I'm in remission yet. I don't know if the cancer's come back. I don't know. You're going to drive yourself crazy, and that stress is going to make you sick.
Right.
And so let's tame that feeling. Let's tame what we believe about the cancer. So that instead of fighting it and throwing more toxic chemicals at it, we start eating better, exercising more, moving our bodies, learning how to be comfortable where we are in life. And that's the important piece of it. Because do you really want to spend the rest of your life being afraid, or being at war with cancer? And that's not the way I want to spend my life, whether I have, 1 day, 1 month, 39 years. That's not how I want to live. And that's how Cancer Tamer came about. Let's learn how to tame it so that we can move forward. Because
Okay.
even if you have metastatic breast cancer, or any kind of cancer, it's, are you doing things to make yourself healthier with where you are? And it's not like, oh, well, let me go take more chemo. Let me go do more radiation. Let me cut something else off. It's really, is that going to be the rest of your life? Let's back up a little bit. And it is getting that information, because the medical community does not give you options. They only have 3 things that they do: surgery, chemo, and radiation. It's like, but look at all the other options that are available, other ways to heal, other ways to address cancer. And those are the pieces that they don't talk about.
o-
Even getting them to talk about nutrition is difficult.
Okay.
So,
Uh, you answered my next question, why that specific name.
yeah.
Let me ask you personally, did you ever get chemo or radiation?
No, I didn't actually. Um, when I After my diagnosis, and I had dual mastectomy done. It wasn't supposed to be a full mastectomy. They were just supposed to do a light lumpectomy. They ended up doing a dual mastectomy. And then from they did an oncotypal diagnostic test.
Yeah, the Oncotype
Because
DX test.
yeah.
Yeah,
And so for those that have DCIS, for the cancer has not shown to have spread, the oncotypal test can tell you how effective the chemo will be.
right.
So when they came back with the results for me, they said, oh, well, it's only going to be 14% effective for you. Not for everybody else, but just for me,
Right.
based on the tumor markers. And my thought was, well, if it's only going to be 14% effective, but you have 100% side effects, what about the 86% if I don't take this medicine? And if I don't undergo chemo? And the response was, well, we don't look at the 86% that you'll be okay. We only look at the 14% with the chemo. And for me, that wasn't acceptable.
So they recommended the chemo?
They did recommend chemo for 32 treatments, and I refused.
32.
I'm like,
32.
32 treatments they wanted to do with me, which I thought one was excessive as hell.
Was that radiation 32 or?
No, it was chemo, 32 treatments of chemo. And
Really?
when they recommended it to me, I said no. I said, let me think about it and do my research, because I'm big on research. So they kind of got upset that I said, I need 2 weeks to research this because I want to know what the chemo is going to do to my body, because I didn't research it. And so they gave me the time. When I came back, I was like, okay, so it's going to help me by 14%, but you're going to destroy my kidney, my liver, and my heart. Am I getting this right? And you can't guarantee that I won't get, that I won't have metastasis or that I won't have another cancer. And they're like, no, we can't. And I'm like, well, then I'm not going to do it.
Well,
Because for me, it wasn't the odds and the side effects and the damage that the chemo itself will cause in my body for 14% was not something that I was willing to do.
yeah, now it's interesting because I had my Oncotype DX test and it came back very low. And then they also did another test, a MammaPrint, and that came back very low. So they didn't even recommend chemo. That was in 2019. That was my first. 3 years later, it came back. So, yeah.
But something new, not coming back. It's something new. And that's the piece that from my perspective, if you have breast cancer today or any kind of cancer today, and you get rid of it, it's not in your margins, it's not in your blood, and you're cancer free because it's not in those 3 things, then whatever happens after that is something new. And that's my opinion, not the medical opinion, but my opinion.
Well, yeah.
And so that's the piece of, well, okay, something that we need to fix is still wrong. And so here we're gonna fix this. And so if you have a new cancer, the way I look at it, because you're getting a new test to find out, well, is this the same? Has it metastasized or hasn't it? So there's so many factors that you're really looking at. And so being conscientious of, am I still being exposed to toxins that most people don't even talk about? Because everybody says, oh, well, it runs in the family. It's like, no. Only about 5% of cancer is hereditary.
Right.
The other 95% are all environmental factors.
Yeah.
What you're being exposed to, what you're eating, what you're living by, what you've, what's been put in your body, things like that. So realizing that there's so many factors that go into it. And so for me, because of the fact that it was such a low percentage of it being effective in the first place, I didn't want to gamble with destroying everything else in my body.
Yeah. I kind of didn't have that option because the second time it came back, it was like in the lymph node. And so they had to take the lymph nodes out. And as a consequence, I got lymphedema, but we're working on that.
Good.
But I did the chemo and I did the radiation. So
Okay.
I mean, you know, everybody's got to make up their own mind and their own
Yes.
decision, and they have to basically go with their gut or whatever, you know,
Right.
at a certain
Right.
point. Now, what do you
Yeah.
mean by we should not be at war with our bodies pertaining to your thinking about cancer?
So, so back in the 70s, President Nixon declared war against cancer. And that's where all of a sudden everything was, we're battling cancer. We have the war against cancer. We are surviving cancer. We are, we have to battle. Everything is fight, fight, fight. And don't misunderstand me. I'm not saying don't fight. I'm saying that there's a big difference between what you think and what you're doing. So if you're thinking, oh my gosh, I have cancer, I have to destroy it. I have to take more chemo. I have to take more radiation. I have to, take these aromatase inhibitors that are going to, and there's just little chemo in that, and so I'll have all these side effects because I'm going to still keep fighting, fighting, fighting. And that's where I say you shouldn't be at war with your body, because if you're fighting, fighting, who are you fighting? I mean, cancer isn't this outside force that you could throw bombs at it, or you can, you can radiate it and it's out there away from you. It's inside. And so as you're doing that, you're poisoning your body, you're radiating your body, you're thinking these thoughts of, oh my gosh, my body's against me and I have to be against my body. Instead of saying, okay, well, let me be together with this and get my body to help me get better, because we all have our intuition. We decide, wow, if I eat that, that's really not that healthy. Okay, so now I'm not fighting, I'm just making a decision to be healthier.
Mhm.
you know and so I don't have to go, oh well, I have to eat these greens because that's what they said and I hate these greens. You're not going to eat them, right? You're just going to be fighting with everything. And so it's that mental attitude as well of, how are you addressing this? Are you going to live your life in anger and at war? Or are you going to turn around and go, you know what? If I do this, it might be a little bit healthier. If I try to do a little bit more movement, that might be better for my body. If I start doing meditation, if I start doing yoga, if I look at acupuncture instead of these pills that they're giving me for pain, and I do acupuncture instead, or I learn how to feel comfortable with that discomfort of having the pain in my chest, then I'm not fighting. I'm not at war with my body. I'm not fighting going, oh, my body's horrible because look, it's giving me all this pain. It's like, no, I realize that I'm going to have this pain in my chest all the time. And so now, do I want to be comfortable with that pain and just go, okay, well, I know you're going to be there. So let me find ways to make it easier. Let me find ways to, to have a good day, instead of constantly be angry, or feel like I'm a victim, or feel like, nobody's going to help me. And so noticing that whatever your mind believes, your body's going to follow. So if you think you're getting healthier, then your body's going to go, oh, right, we're getting healthier. And so you start working with your body. You start noticing, well, if I do eat healthier, I have more energy, I have more stamina, I have more more energy to be able to do these things for myself. Also the fact that there's so many complications that come up, and things that we need in order to make our lives easier. And how are we going to get to that? How are we going to connect with that? Like something as simple as a lymphedema pillow, which nobody ever talks about the pillows or anything, and so if somebody were to tell you, hey, if you have lymphedema, and right after your surgery, let's get you this pillow so that you're not rubbing against the stitches right after you had surgery. Let's just get this I got one right here, actually.
Okay.
this little lymphedema pillow, which you just put underneath your arm. And it allows you to have that buffer between your arm and your sutures. Also,
I wish
after
I would have had
surgery,
that.
yeah,
Nobody
we
ever mentioned
actually
that one to
part
me.
of, yeah, my sister actually made these for me after my surgery. And so for Cancer Tamer, we started making them for everybody. It's like, wow, these really work. Let's just make them and give them away. And so we do that. And so the whole piece on that too is that you can use it as a buffer against your chest and the bed when you're going to sleep, or you can use them in the car when, what really hurts is that seatbelt coming across your chest. Even, it could be a couple of months after surgery and you still get that pain in your chest. And so you can use this lymphedema pillow as a little buffer up against the seatbelt so that it doesn't go up against your chest. And so those are the pieces I say, instead of me sitting there fighting with, oh man, I have pain, it's like, okay, well, let me find a way to minimize that. Let me find a way of being able to live with it better. And that's what I mean by not being at war, by being able to tame. So let's think about how we're thinking and how we're getting along with ourselves, with our body. And I have to say, it's been 7 years since I originally had breast cancer, since I had my surgery, and I still get a lot of pain in my chest, but I find ways to make it better. I find ways to go, oh, okay, I know that pain there. Let me do a little bit of biofeedback. Let me do a little bit of meditation. Let me refocus on other areas of my body that aren't experiencing the pain so that I don't get stuck with that thought and
Okay.
get caught in that cycle.
Uh, Okay, I just want to clarify something
Sure.
because I'm getting the impression, I mean, you're not telling people out there if your doctor says you need chemo not to get it. You're not saying
Oh,
that.
no, by no means am I saying that.
Okay.
I think we
I
all
mean, I just
have
don't
the
want somebody
right
to
to
get the wrong
choose.
impression,
Yes.
of what you're saying.
And that's why I don't talk about my treatment per se, because I think that everybody's choice is their own.
Okay,
And you need to go and you need to talk to your doctor and say, hey, what is right for me?
right,
And my piece is more of, there's three types of people who get cancer. You have the ones that I don't care what you do. I just want to live, do whatever you need to do, and I'll just grin and bear it and keep going. So you just tell me what to do. Then there's the ones that are like, well, you tell me what to do, but I also want to do a little bit more, and can we have a little bit more of these things, some alternative or complementary
right.
medical treatments. And then there's the ones that say, well, I don't want that treatment because it's not right for me.
Okay,
And if you're going to give it to me, then give me all the facts so that I can make the correct decision for me at this time on this day. And so it is that part of always talk to your doctor, always get a second, a third opinion, always find out what other options are there. And if you decide to do the medication and the treatments that they give you, that's perfectly okay. When you're having issues, ask them about it. When you're having side effects, because the one piece where I get upset is that they'll say, oh, well, especially the aromatase inhibitors that they give you, the anastrozole, Arimidex, tamoxifen, those things give you neuropathy so bad. I don't know about you, but it felt like Chucky was visiting me and just stabbing my feet. And I couldn't feel my feet, or if I did feel my feet, I felt stabbing pain in it. And so for me, it was like, wait a minute, this isn't normal. there's something going on. What's going on? And they would say, oh, well, that's normal. It's normal for you to feel that. And I'm like, no, 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 that's not normal. That's a side effect. That's two different things. A
Right.
side effect is a side effect from the medication. Let's see if maybe there's a different medication that I can take
Yeah.
that won't give me this side effect. And so being conscientious of if the treatment plan that is prescribed for you isn't something that you can handle, isn't something that you want, is something that you want to do a little bit more and put some complementary holistic factors in, then those are things to talk over with your doctor and say, look, can we have a little bit more over here? I don't want to take, these pain medicines. Can we try marijuana? I don't want to do this. Can we try this other alternative? I don't want to do this. Can we do yoga for movement? I'm not eating healthy. Is it okay if I go to a nutritionist? So it's being able to have all of these other factors. And are those things you do have to talk over with your doctor. What I am saying is that it's okay for you to say, that's not what I want. That's not the course that I want for my life. No, I don't want to do chemo, or no, I don't want to do radiation, or no, I don't want to do all these other things because they're affecting me adversely, or they're going to hurt me more than they're going to help.
Right.
And so that's what I say, you need to know the facts. And it's okay if you don't want to know the facts and you just want them to do whatever they want to do. It's perfectly okay. I don't have a problem with that. It's your life. And that's the way you want to live it. I'm happy for you. But for me personally, that's not the way I wanted to live my life. And so I did things slightly different.
Yeah, makes sense. Makes sense. And,
Yeah.
and I am on one of those aromatase inhibitors. And
Yeah.
well, I failed on one, so they got me on a new one, which I'm not totally thrilled with. So I'll be talking about to the doctor about that. Let's move on. Tell us
Yeah.
about your play, Breast Cancer Diaries, and where can we see it?
So Breast Cancer Diaries actually came about because I had so many weird experiences while I was going through breast cancer that I just wanted to know if other people were experiencing the same thing. And sometimes there was inappropriateness by the medical staff. And I thought, is it just me? I mean, is it my attitude? Is it the way that people see me? Is it what the hell's going on? And so I started asking people, well, what's your experience? What do you see? Are you getting the information that you need? Are you being, bullied by your doctor? Are you being inappropriate? Is anything inappropriate happening? And I started interviewing women and men, and I got so much information that just had me shocked. And so it became, and then I went to because you mentioned Male Breast Cancer Happens, the
Right.
conference that they had in 2019. And so I went there and I learned all about men going through this experience. And I interviewed a whole bunch of you guys, and I put all the information together to be able to then do the play. So the play is actually a compilation of over 100 stories from men and women who have experienced breast cancer and what it's like for them. And so the play takes you from the day that you notice that there's something wrong, that you notice a lump in your breast, and you start wondering, well, is this cancer? Is there something wrong with me? Do I need to, and so taking it from that to taking it, the next step is, okay, so you went to the doctors, now you got diagnosed, and here's your diagnosis. And so we have, the play is set up of 8 different people, 1 male, and you see how they go through everything. You see how they get diagnosed. You see how they talk about dreams. We talk about suicide. We talk about depression. We talk about we talk about all the different experiences, or not all of them, but a lot of them, on what's going on. And there's a part in it where we talk about our diary entries. And that's where the name, Breast Cancer Diaries comes from. it's all these stories from individuals, men and women. And so the play is talking about those
Okay.
and good experiences, bad experiences, hilarious things that happen along the way. And it's just it became so wonderful. Um to be able to do that, to be able to bring all those stories together. And we also did a part of it was the documentaries that we showed with the play, that people were talking out, and so you would see the different stories also in the documentaries, some of those stories, so that you could see that it's all these people, it's different people and how they're experiencing it and what they wish they would have known, or their hope for the future for other people.
Now, I know the play was performed in New York.
It was
Uh,
originally performed in New York, yes.
yeah. Uh,
Yeah.
is it
So
going to be performed in other states?
yeah,
And
we
can groups out there produce it?
perform it.
Yeah,
Yes,
yeah.
definitely. So we originally performed it. I wrote it in 2019 and we performed it like 6 months later. Um, and everybody in the play, which was so wonderful, with the exception of two of the actress, everybody else in the play in the original were breast cancer patients. They had been diagnosed. And so as we're rehearsing for the play, you would see, sometimes because some of the topics are tough. And so we would have our own little therapy session as we're practicing for the play and then going back to do the rehearsal. We did it in New York. We sold out within 2 weeks.
Wow.
So it was it was an off-Broadway sensation. We did it in Staten Island, we did it in Manhattan, and then COVID hit. And then I moved to Florida and we've done it here in Florida. We did it in Spring Hill at the Stage West Playhouse. Excuse me. And it was a success there too. We had 2 days that we did it. And what I thought was so wonderful was the first night you had a lot of individuals, and it was the first time because the first play I was able to sit, I was part of the cast. The second time when we did it in Florida, I was part of the audience, and it was wonderful to see the reaction of the audience on how they were taking it in. And on our first night, we had people tended to be quiet. There was some people were like, "Oh my gosh, I didn't know how horrible it could be sometimes for people." And in the matinee, we had a group of women who had breast cancer who came to watch the show. And what I thought was so cute was that you hear, "Yep, that happened to me. Yep, that was me." And so there was so much interaction between the
Yeah.
cast and the audience, because the audience was going, "Yeah, that's right. That's what happened." And it was wonderful to see that. I do have it to where we offer it to other organizations to be able to perform it for themselves, to
Yeah.
be able to raise funds for them. They just need to let us know. We'll work with them on the copyright issue because we do have the copyright to the play. And so, we just have to, a small little, three little things that they have to do to make sure that we stay and we honor the stories that we're giving, that we're sharing. Because people ask, "Oh, well, how did you come up with the play?" And it's like, well, I really didn't. It's stories, it's true stories. Everything in the play is true.
Right.
And so it's being able to honor the person whose story that is. And that's his story, that's her story. This is how it went for them. And so what we did this year, when we did the stories, I actually changed some of the stories for this one so that more stories could be heard.
Okay.
Um,
Okay. So for those out there that are going to be or listening to the podcast, we'll give you the information how you can get a hold of Dr. Charlie and maybe work this out in your area. You might be in California, you might be in wherever. Colorado.
wherever,
Yeah.
Timbuktu. We actually have, we've had a request to perform it in Wisconsin. We've had a request to perform it in the UK, which I'm like, I'll be there opening night,
Yeah.
you know. And I've written it in such a way that when the director for your play takes on and does the blocking and does it how they want it to be portrayed, it does look different in each show on how it's being directed is what makes it different, how the characters are interacting with each other, how they're interacting with the audience, and you get that different feel. So, so we do help a little bit with the directing if anybody needs assistance
Yeah.
with that, but we allow the directors to put their own flavor to it.
Okay. That
So
sounds great. Now
yeah.
you've created documentaries, Messages of Hope, Faces of Breast Cancer, which I was fortunate to be included in. Breast Cancer Men Speak Out.
You were
Uh,
in that one too.
yeah.
You
Why?
were in all of them.
I'm telling you, yeah. I'm one
Yeah.
of your actors here.
You're one of my actors. Yeah.
Why did you produce tell the audience why you produced a documentary just for men?
I thought that there is a uniqueness to male breast cancer. And it is that piece of, yes, we're all having chemo, surgery, radiation, if that's the treatment that we're getting, but we experience it differently. Men experience a different connection to their breasts than women do, and also how they're treated. Because it was very shocking to me to find out that men are treated with a lot less compassion and sometimes a lot less respect. Because, even in the play, we talk about where men have been kicked out of support groups because it's just for women and just for people with breast cancer. And it's like, well, wait a minute, I have it too. So why aren't you accepting me? And so it becomes that part of, men have a unique experience with it, and that's what I wanted to show. And I know Brett and a couple of you were, Brett says, well, I thought I was being punked when he was diagnosed. Where's the camera? Who's punking me
Yeah,
now? And then Mike thought that they must have had his medical records
right.
confused with his sister,
The wrong
because
chart.
his sister,
Yeah,
yeah, because his sister had breast cancer. And so he's like, no, 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 that's my sister, that's not me. And so realizing that, or they put you guys in pink gowns, or they when you're going in for your mammogram, oh, you're not supposed to be here, get out, this is just the women's area. And it's like, well, I'm here for my mammogram
right,
too,
right.
from a male perspective. And so I thought it was so important to show the men by themselves being able to talk amongst themselves, to be able to say what was true for them, and noticing that you're also connected in a different way, because then it's like there's some shame in it as well. It's like, oh, well, I'm a man, I'm not supposed to have that. One of the stories that we talk about is one of the men that was going off to Vietnam to go to war, and he got diagnosed with breast cancer, and he felt such shame that he had breast cancer that he never told anybody for like 40 years. So it does become the part of, are you noticing how you're treating our men? Something as simple as, when a man says, hey, I got a lump in my breast, and the doctor says, oh, don't worry about it.
Yeah,
That's just growth hormones, or that's, that it's typical for a man to get that as just, ingrown hairs or something. And they don't go further than that. They don't go and investigate to find out, yes, there is an issue, or doing that compassionate piece of, men have breasts too, and you end up with scars. And one of the one of the comments of during the play from Brian, our male cast member, was, I have breasts too, and my breasts were removed. I lost my nipple. I lost both my breasts, and I can't hide it behind a bra. I can't hide it behind something else. And I've been mutilated, and nobody talks about that for me. And so being able to notice that, to say, well, where are the male services? Where are they getting help? Where are they, able to talk to somebody and be able to say, hey, I have this issue, and how do I talk to my wife? How do I talk to my kids? How do I talk to my boss? Because, you're supposed to be the macho thing, and macho men don't get breast cancer, you
Yeah,
know?
yeah.
So that was why it was so important for me to do just men talking amongst themselves and talking about their experience and what it was like for them, because it is different than women.
Yes, and I'm glad you did that. And I might also add, for anybody listening out there, I personally run a support group for men once a month, where we all chit chat together. It's not recorded, it's just a private conversation on Zoom. It's virtual. And if you know anybody that has male breast cancer, or you have it and you're listening, you just get a hold of me at it's a wrap with rap@gmail.com, and I'll get you to the place you need to go to come to our meetings. Dr. Charlie, well, you are an author. Briefly, can you tell us about your books, Breast Cancer from Diagnosis to Surgery, and Breast Cancer, Inspirational Quotes, Thoughts, and Comments? Can you briefly tell us
Sure.
about that?
Sure. So, breast cancer from diagnosis to surgery was actually my first book on breast cancer. And so it talks about the different tests that you're going to have, how to go through them, how you can mentally prepare. It also talks about how to set up a support group. Some of the little tidbits that you don't know, like how to prepare your house for when you come back from surgery, because most people think it's like, oh, you had surgery and you're going to be fine, and you can cook your own stuff and get stuff. And I remember I prepared for my surgery. I was so proud. I did like a week's worth of food, had it all packaged up in little individual containers and so on. And the day after my surgery, they don't let you eat the day of, so you're starving. So at 4 o'clock in the morning, I get up, I'm starving, I'm going down the stairs. I couldn't open the fridge. That little suction on the fridge, I just couldn't open it. So here I am, all my food is in the fridge, but I can't get to it because I can't open the stupid fridge. And so I'm calling my friend, and I'm like, could you please come and make me something to eat? I'm in so much pain. I need food. And she's like, Charlie, it's 4 o'clock in the morning. I'll be there in a couple of hours. And so I'm just thinking, oh my God, I'm not prepared. And then things as simple as, you know, you're not able to lift your arms. For me, I wasn't able to lift my arms because every time I lift my arms, I had so much pain in my chest from all the surgery. And so it's like, well, I couldn't lift a bottle of water. And my friend thought, well, let me get you some milk. So she bought me a jug of milk. Well, here's a gallon of milk. I can't lift the stupid milk. So I'm thinking, okay, well, maybe if I just knock the milk down on the counter, I could just like lick it up, and maybe some of it will fall into the glass, you know. But then it's like, okay, now I have to clean up this mess. And so these are things that you're not told. So we talk about that in the book. And
Okay.
we also talk about your mental health, ways to look at things, things to consider, support groups that you might want to go to be able to get education, to be able to know that you're not alone. And so there's a whole bunch of information in that book on how to go from here to there. Then the breast cancer quotes, inspirational quotes and such. I think that we all need those inspirational quotes every now and then. And so as I wrote the book, I got some quotes that I really loved from other individuals, from famous people, from not so famous people, and then just thoughts that I had along the way of thinking through things, of being able to say, do you really want to live your life angry? What do you want to choose for today? Because that is the one piece that we always forget, that we have a choice, and everything we do is a choice. Even not doing something is a choice.
Right.
So do I choose to eat healthy? Do I choose to have a better lifestyle than I did before? Do I choose to have this medication? Do I choose to look at alternative options like yoga, meditation, acupuncture, qigong? Do I choose to do those things to help me with my body? Or do I not? Do I just woe is me, and there's that big cloud over your head like in Bam Bam, and is that how you're gonna live? So realizing that every day we do choose what we're doing, how we're going to live, and how we interact with our partners. Because that is the one piece, that realizing that our partners are also going through breast cancer. Your wife,
Absolutely.
your
Yeah.
husband, your lover, they're going through it too. Your kids, everybody that's in your life is going through breast cancer along with you. They're experiencing it from a different perspective, but they are experiencing it as well.
Are you working on any new books?
I am actually. I'm writing a book called Breast Cancer 101: What You Should Know But Aren't Told. And so it is all these little tidbits that you need to know. Kind of like um my favorite is for women after you have your surgery, and realizing that you have a lot of pain in your chest. And so when after you have gotten rid of your surgical pads and stuff, how to keep your wound care well, how to, one of the tricks that I learned was, you put a t-shirt on, you pull it out, you put all the pads in front to cover your wounds, and then you put your bra on top of it, so that you have that extra cushion
Makes sense.
against your chest, because you do need to have a bra to hold what is left of your breast. And you need to also hold up those sutures so they don't tear. Um, so there's tidbits like that. There's also how to prepare your house for when you come back from surgery, how to set up your meds. Something as simple as, will you remember? How to set up your bathroom. Because most people don't think about, well, I would like to take a shower sometime, but I can't lift my arms up, so now I can't reach the shower heads. Or when after your surgery and you're trying to take a shower instead of a bath, because you might get in the bathtub, but you might not be able to get out. And if somebody comes and pulls you by your arm, you're going to feel all that pain in your chest. So it's these little tidbits that people don't talk about. Also being able to talk to your doctor and saying, look, these are the issues that I have. What can we do about them? How can we address them? What about the fatigue that I'm experiencing? Because we'll get tired all the time. So how will you deal with that fatigue? Can you get naps? Do you tell your family about your breast cancer? Do you not? Do you tell your employer? Do you not? And if you do, tell it for the employer, for instance, um, if you then get fired, then what are you going to do? So here are some resources that you can connect with, because they can't fire you for that, especially for men. Because for women, you more easily have a legal issue, which you have it for men too, but men don't think of that,
Yeah.
because they don't think, oh, well, if I'm a man and I work construction, how is that going to work? If I'm a man and I work, say, at a not just a factory, but like at Home Depot, and I have to lift all these boxes. How can I do that? Because that's going to hurt my chest. And so now my work might be in jeopardy because I can't perform. So realizing that there's so many aspects that go along with the breast cancer, it's not just, oh, you got your surgery, you got your chemo, and you're done.
Yeah. And I might add,
Yeah.
for everybody out there, I'm really looking forward to that book. Please, let me know when that gets released, because I will definitely promote it
Thank you.
on my social
Yeah.
media. And I want to tell everybody, Dr. Charlie's right, spot on. They really don't talk about this stuff. This is all stuff you have to learn on your own,
The
and
hard way.
the hard way. Yeah, the hard way. And it's wonderful that you're writing this book and people can get that information, because
Thank
it's
you.
it's just important. Uh,
Yeah, I've got 100 and I've come up with 157 things that I want to tell you. And I start writing and then I get a little wordy because I'm trying to cover as much of the topic as I can. And so something as simple as transportation. And that's one of the things that one of the chapters that I just wrote yesterday. And when I was talking to a friend, I'm like, oh my God, I wrote 8 pages. I had over 4,000 words. And she's like, well, it's just transportation. What the hell, why is it so long? And I'm like, because it's not just transportation. If you can't drive yourself, who's going to drive you? Are you getting, if you got Medicaid, Medicare, whatever, did you know that you have a form, a 2015, that your doctor can fill out so that you can get transportation? So now they can take you back and forth to your doctor. And the fact is that most insurance companies will allow that as well, but they only give you 18 sessions, or some only give you 12 visits, not visits, but rides. So if you're going to chemo and you have 16 chemo visits that you have to do, now you've got 32 visits. If your insurance company is only giving you 12, what are you going to do for those other 20? How are you going to get back and forth? And you can't pay for it because you can't take Uber back and forth. I mean, you can, but that becomes very expensive and you're
right.
going to have so many bills. And so, I talk about, here's these forms that you get. Even though HIPAA says, don't tell us what you have, when I tell people about that form, I'm like, have your doctor, and if your doctor won't do it, you do it. Write really big on the top, has cancer. Because now they know that they need to hit that little button that says unlimited rides.
Right.
So they don't stop you. And then you have to fight for 2 months to get the rest of your visits back and forth to be able to do that. So it was that piece of, when I answer the questions, I try to put in all the information that I can think of that I've learned along the way. And the book is being written in such a way that if you have a question about something, just look for it. Transportation, here's your answer. Showering, here's your answer. What was the other one? Gauze pads, here's your answer. Because did you know that your doctor can write a prescription for gauze pads and you don't have to pay for it?
Sure.
And people turn around and go, oh, well, it's no biggie. It's only $5 for 25. And it's like, really? You end up using 2 gauze pads, right? For each side of your breast. So if you had it on both sides of your breast, that's 4. And how often do you clean those pads? Twice a day. So now you up to 8. 8 and 25, you're done with that 1 pack in less than 3
You're
days.
back in the drugstore buying another pack.
And you're back in the drugstore buying more. And so by the time you finish for that week, you got like a $20 fee of nothing but gauze pads. By the end of the month, that's $80
I,
on top of everything else.
I don't want to tell you how to write the book, and I'm sure
No, please
you probably thought of
feel
this,
free.
but I think I would hope that you would have a section on there about people that are alone and live
Yes.
alone,
Yes.
because there's a lot of people out there that are by
There's
themselves.
a lot of people out there.
Yeah,
And I
yeah,
have to say, I went through breast cancer alone at the beginning. I didn't want anybody to know. I wasn't anywhere near my family. I didn't, you know, I was very proudful, and I can do it on my own. And it's like, no, I can't,
yeah,
And so in each chapter, I talk about that issue as well.
good.
Don't go it alone, even if you have to, call the local organization or call somebody in your church and say, can you come and sit with me for my surgery? Can you come and, and sit with me and just talk to me while I'm trying to cook? Because one of the things that happened for me was I ended up getting an immune disorder called sweet syndrome. And so what happened was that my my skin, my sutures let go. They dehisced. And so they couldn't keep the skin together. So I actually had open skin, open wounds. And so I couldn't move my arms because every time I moved my arms, it tore at the sutures. And so everything, I look like a zombie. And so whenever I tried to move my arms or lift something, I could cook, but I couldn't get the pots off the stove. I couldn't, something simple. I just couldn't get it off the stove. So I needed some assistance in that. And so, as you say, there are a lot of us out there that are going through this alone. Or even if you have family, you still go through some of this aspect alone. Because if you try to talk to your family about things, sometimes it freaks them out. It makes them scared. The one area that I see, and one of the biggest areas in the book, is the part about talking about death. Because the minute you say, well, I want to do this before I die, my family hated me saying that. But I would say, well, I want to try to do this before I die. I want to have all these pieces before I die. And and if I said, well, I don't want to take that medicine anymore, and they're like, oh my God, you're suicidal. Don't give up. Don't stop. You have to fight. You have to be strong. And I'm like, I'm not suicidal. I just not want to take that. No, I'm not going to do that.
It's
No,
not
I'm not going
making
to.
me feel very good.
Exactly. And
Yeah,
it's like, let me reassure you that I don't plan to die. I just don't plan to do that. I want to do something
it's
different.
affecting your quality of life. Absolutely,
Exactly.
absolutely.
Exactly. And it is very important of realizing that sometimes these issues are hard for our family to accept
Yeah,
and hard for them to talk about because they don't want to talk to you about dying. Well, look, if I die, here's all the information. Here's my will. Here's this, here's that. And they're like, no, 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 you're not going to die. I don't want to hear it. I don't even make a will. And that's another part that nobody wants to do. If I do, if and the way I look at it is the minute that you do your last will and testament, you're actually acknowledging that you're going to die. It doesn't mean you're going to die today. It doesn't mean you're going to die from breast cancer. It doesn't mean you're going to, die from whatever. But you're admitting that
it's
somewhere along the line you're going to die.
yeah, yeah,
And and I think that's what stops people from signing on that little dotted line. Because I know when I wrote my will and I actually went and I did it at the attorney's office and they had their staff come in to know, to witness that it was me doing it. And I just burst into tears. And I'm signing it, just going, okay, it's me. And, and everybody's like, oh, don't worry, dearie, you're not gonna die. And I'm like, of course I am. It's like I'm not gonna die from breast cancer, but I'm gonna die someday. And and it was that piece where when they kept telling me that, I'm like, oh my God, this is just too funny. You're an attorney, I'm gonna die someday, but you guys are insisting that I'm not. And it just became really hysterical. So there I am with laughter while I'm crying, while I'm signing my will. And now it's just that admission of, yeah, someday along the way, but I want to protect my family and I want to make sure that the people that I want to have certain things, they have it. So,
yeah.
yeah.
Dr.
So,
Charlie,
so many things that are in the book that we talk about.
Dr. Charlie, how can people contact you?
They can contact me through Cancer Tamer. So cancertamer.org, O-R-G, info@cancertamer.org. They can also call us at 718-916-4124. How else can they, if they are in Florida, now I'm in Florida, they can come and visit. We do part of Cancer Tamer does a lot of educational pieces and different workshops that we do. One of the workshops that I found that I haven't found anybody else doing is a workshop on being able to mourn your breasts. Whether you're male or female, that is a part of your body that you're losing. And so being able to say, hey, this is something that's no longer with me, especially for women. How can I say goodbye to something that was a part of me? Whether or not you had reconstruction, you still lost what was originally there. And so being able to have the ability to do some releasing along those lines. So
Dr. Charlie, what words of advice do you have for people out there newly diagnosed with any form of cancer? It doesn't have to be breast cancer, and their family members, to keep in mind and help them make decisions regarding the cancer journey? What advice do you have?
I think the best advice that I can give you is not to do things out of fear. It's okay for you to take a moment and sit with the information and decide and do some of your own research, to ask for a second opinion, to ask for a third opinion. And always, and I always think this is funny, but people will go, can I talk to your the doctor in your practice and get the second opinion from them? It's like, no. When you get a second opinion, you go to a different hospital, you go to a different organization to get your second opinion. And so being able to know that if you're doing things just out of fear, you're going to get stuck in that fear mode. And so the more information you can get, the more information that you can learn and the options that are available for you and your family, then you can actually make a more informed decision. And you can go, well, I don't know that much, but I think this might be better for me. And knowing that it's okay for you to decide something today and change next week, or decide that, I tried this and it's not working for me. Can we do something else? And it's okay for you to be able to give your opinion and to tell your doctor, this isn't working for me. This isn't the quality of life that I want to live. Let's find something else. And if your doctor isn't being respectful, or you feel that they're bullying you into making a decision, or hurry up and do what I tell you, get a different doctor. Go somewhere else and get your treatment. And being able, that's your right. You have the right to say, no, this is not working for me. Let me go somewhere else. So
Great advice. Thank you so much. I want to thank you, Dr. Charlie, for being here with us today and showcasing all the great things you are doing for breast cancer patients and their families. And I wish you great success as you continue your work in the breast cancer arena. I know I'll be working alongside you in the near future. Comments and suggestions for the podcast, you can email me at itsawrapwithrap@gmail.com. Our Facebook group is It's a Wrap with Rap. And I think we have a couple thousand members now. So
wow, awesome.
that's a great group. We're on Instagram, It's a Wrap with Rap podcast. We're on Twitter, or X as it's known, at Rapper, WRAPPER 130. That's 130. Our website is itsawrapwithrap.com. All the episodes on YouTube, It's a Wrap with Rap, the podcast uncut. We don't edit the podcast on YouTube, so whatever's on there is on there. I want to thank you once again, Dr. Charlie, for being with us.
Thank you.
And spending time with us. And I want to thank everyone for listening. Everybody, please stay safe. And for now, it's a wrap.